we think about probably in the last few years, AI getting very popular, or getting like it's a novel thing that we're thinking about implementing artificial intelligence in healthcare. And the reality is people have been thinking about it for 30 years. So. Hey everybody, welcome to another episode of the Better Outcomes Show. I'm your host, Rafi Salazar from RehabU Practice Solutions. If you want to learn more about me, go to rafisalazar.com. If you want to hire me to speak, speaking.rafisalazar.com. And if you want to learn more about what we do at RehabU, head on over to rehabupracticesolutions.com. All right, this week we are diving into the world of AI. I know we've done a couple episodes in the past, but this is specifically going to review the idea of how artificial intelligence, the kind of the rapidity or the acceleration, if you would, of research being published around AI around healthcare. Like, how is AI going to impact this piece of healthcare or that part of healthcare? I'll throw in some of my thoughts about what it means for providers, billing, insurance versus value-based care. I'll talk a little bit about kind of the regulatory impact, because being on a national regulatory board and also a state regulatory agency over the last 10 years or so, give or take, I've got a little bit of insight there, just some things to think about, and maybe even talk about some businesses that can be brought up around AI in healthcare. I know AI is one of those big things. It's like, it is the thing to talk about in healthcare, and honestly, I think a lot of it is overhyped, but we're still going to talk about it. So let's dive right in. What I'm going to do is, this article came across my feed. Maybe, I can't remember. I'm on a few email lists for some journals that publish and put things out every now and then. And they'll send you an email with like, these are the articles on, this topic or whatever. And I got one the other day, a couple weeks ago, from an older article that was published a few years ago. But it was a scoping review. So I'm just going to read the title here. That way I get it right. Let's see here. The title of the article is "The Role of Artificial Intelligence in Healthcare, a Structured Literature Review." And it was published actually in BMC, Medical Informatics and Decision Making a few years ago. I think 2021, tail end of 2021. So at the time of this recording, about 4 years ago. So I'm sure some of the research and stuff, there's been even more articles that have been published. But the basic premise here is that they reviewed 288 papers, or peer-reviewed published articles, between a 30-year period. So from 1992 to 2021, so 29 years. And they broke them apart and kind of put everything into buckets. AI is going to affect this topic or this topic or this topic or this topic. So the first thing I want to do, though, is just share just one of the graphs from the article is pretty interesting to me, because when if you think about it, I was not thinking about artificial intelligence and machine learning 20 years ago. I was not thinking about that at all. But there are people in the field that have been. So let me share just this window here. So this is a chart from the review, from the article, and you can see all the way back in 1992 there were a small amount of articles published on artificial intelligence in healthcare, and basically the keywords they were looking for was like artificial intelligence specifically in healthcare. And you can see it kind of flatlines. I mean, a couple single-digit articles are getting published over the years from between 1992 to about 2002. Then it kind of jumps up a little bit, dips back down during the 2006, 2007, 2008 range, but then it kind of starts just stepping up every couple years, bumping up a few, all the way to like 2020, 2021, where it kind of bounces all the way up to over 75 or 80 articles published in those timeframes. So again, I think just for context, right? Like, we see artificial intelligence coming onto the scene, in healthcare and thinking like, oh man, it's just in the last couple of years that it's really exploded. But the reality is, you can see it's been very small volume of research, but there has been research done on this topic and people thinking about how AI is going to impact healthcare for about 30 years or so. Again, probably the volume of research expanding so quickly has to do with the amount of advancements of technology. It's one of those things like if you see the exponential curve, right? Like it's becoming cheaper, quicker, faster, more sustainable to build tools around artificial intelligence now than it was 10 years ago, right? So you're going to get some corresponding growth in the amount of research being published. But I just thought it was interesting that this is one of those things that we think about probably in the last few years, AI getting very popular, or getting like it's a novel thing that we're thinking about implementing artificial intelligence in healthcare. And the reality is people have been thinking about it for 30 years. So we'll stop sharing here and talk a little bit about some of the findings from the research. So obviously, AI in healthcare is a rapidly growing field now. You can see that just in the amount of articles that have been published just recently. What is interesting, though, is that of those articles that were published, 288, 70% of those authors only published once, which shows that one of the conclusions or the findings from the study was that this is showing that there's a young, expanding contributor base to the research. So they're thinking, one of their potential conclusions is that there's going to be a whole lot more studies and research done in this area because if the growth in number of publications comes from a larger number of researchers, well, those researchers are going to be in academia for the next, potentially 10, 20, 30 years of their career. And generally, when you get into a field like that, you start researching in a specific area, you start going deeper and deeper, you ask more questions with each subsequent paper or each subsequent study. So if you've got 70% of those coming from brand new researchers, theoretically, those researchers are going to continue to publish and publish and publish while more people are coming into the field about it. So you could get this really great expansive, like exponentially expansive growth of research in the artificial intelligence space, which is just exciting. So the article, the study, kind of broke down topics to 5 core applications of artificial intelligence in healthcare. So the first one was healthcare service management. The next one was predictive medicine, then patient data handling, diagnostics, clinical decision making, and those are the 5. Now, I think they kind of grouped patient data handling and diagnostics together because you need patient data in order to do some diagnostics. I'm breaking it apart because I think they're separate. So I just wanted to spend a few minutes talking about each one of those. So the first one being health services management, or health, like how do we manage the operations of healthcare organizations, if you would. And I think one of the big areas where artificial intelligence really shines is like automating some of those things that have been manual tasks, right? That's not like a novel breaking thing. But one of the things that the study said is that one of the notable aspects of artificial intelligence is the potential to support comprehensive health services management. And just to quote the article here, the applications can support doctors, nurses, and administrators in their work. For instance, an AI system can provide health professionals with constant, possibly real-time medical information updates from various sources, including journals, textbooks, and clinical practices. So think about like a little widget or something like that that's in the EMR, and a clinician is putting in information, maybe lab values or reviewing lab values or something like that, and a little dot or notification pops up, and it's a recent finding from some studies that were published or something about this specific diagnosis or these specific lab value variations or something like that. That is super cool. And it also helps kind of cut down on potentially it could help cut down on the time. We've covered it here on the podcast a few times, but the amount of time that it takes clinical research to be applied as everyday practice in healthcare is long, right? Like 17 years. And part of that is because healthcare academics and researchers and studies, even publications, just have a hard time getting the information out. It's a marketing problem, communication problem. But then there's also the barrier of like taking this new knowledge, having clinicians take this knowledge and apply it to their already built-in workflows or routine and stuff like that. So having some sort of proactive approach where you have an AI web application or something like that that is constantly feeding or prompting, not taking the place of clinical decision making for sure, but prompting and providing those resources to clinicians. Like I think about the little, this is going to probably show my age here, but when Microsoft Word first came out, you had the little paper clip, in the bottom corner, and it was like, hey, you might want to format it this way, or, maybe hit these keys and it will, format your paragraph for you, or it'll enter this citation or whatever, the little help bar, right? And you're taking that, connecting it with a bunch of data sources that are really too much for clinicians, honestly, to be able to handle on their own, and making it much more easy and more specific, right? Because again, the amount of volume of research that's published every day just keeps on growing and growing and growing and growing. It's hard for clinicians to keep up. One of the great things that artificial intelligence can do is it's really good at sifting through a whole bunch of information and data very quickly and serving up relevant information. So it's just a cool piece of application, or a way to apply AI in healthcare in a way that doesn't, I think people are like concerned about AI taking jobs or whatever. I don't think that's the case, but a way of artificial intelligence really practically assisting clinicians in a way that doesn't, threaten the removal or impairment of clinical decision making, really just looking at it as a force multiplier. It's allowing this clinician to sift through all the research that they would want to sift through, but don't have the time. It's going to give them the ability to do that quickly, efficiently, and more specifically for each individual patient or case that they're working on, which to me is it's a win-win-win. So again, quoting from the article here, it says AI applications allow, for example, hospitals and all health services to work more efficiently for the following reasons. One, clinicians can have access data immediately when they need it. Nurses can ensure better patient safety while administering medication, for example. Patients can stay informed and engaged in their care by communicating with their medical team during hospital stays. So, and that's just the clinical care side of things, right? Like you're not even covering things like logistics, supplies, drug and pharmacy management, things like that. I was talking to a guy the other day as part of my consulting work, and he's in the middle of raising a round for a company that their whole goal is they're using artificial intelligence, but they're really trying to streamline logistics and supply orders and operations for hospital systems. That is their game. And it looks like they built something very, very cool around it. And they are able to use their AI models to streamline logistics and like take something very simple like supply ordering for PPE, masks, gloves, gowns, that sort of thing. And because of their model, they're able to not only optimize the amount that's being ordered based off of trends that hospital system, can look back and say, okay, based off of the last 12 months of ordering patterns and volume and patient volume and all of that, this is, we got to order more this month, or we got to order less this month. So you're only ordering the amount that you need to, and it's on autopilot. And then they're also streamlining the logistics. We're going to order it from this supplier over here because of the cost, but it's going through the warehouse and the shipping, so they'll all get here at the same time and at the same, maybe lowering the shipping costs together. And again, this is something that would take a team of like a logistics department, maybe some more manpower to do, time, dollars, energy, to the point where like a lot of hospital systems, like, why shop around? We're just going to order from one place because that's where we order from, and it would take too much time to try to go and sift through and find better prices for all of these different commodities that we order all the time, these consumables, right? So using AI in that instance could potentially lead to hundreds of thousands or millions of dollars of savings a year for a health system. And that's like big value. And again, that's a way that AI is being applied to the health services side, the management side of things, that's not really impacting patient care, so to speak. It's not impacting a clinician and their decision making, or even the services being delivered to the patient, but it's making it more efficient. It's making it more financially sustainable, which hopefully leads to better clinical outcomes, because it means that the organization can spend more resources in direct patient care and stuff like that. So that's point number one. It's health service management, which again is exciting. Predictive medicine, and I think this is one that we've talked about a little bit on the show. I think we had somebody on maybe a while back that was doing using artificial intelligence for like predictive modeling for maybe disease outbreaks and things like that. I'll have to go look back, and we'll link to that in the show note. I know we've done a couple on diagnostics and things like that, and even Dr. I can't remember. Dr. Harvey came on and talked about ChatGPT. ChatGPT in healthcare, I think is the name of the book. I'll have to link to it, but it was basically how does large language models like that help clinicians in the clinic, which we'll get to in a minute. But predictive medicine, basically one of the things that it can be applied for, at least the authors of this study, that reviewed 288 research topics or research articles on artificial intelligence in healthcare, said one of the relevant topics for AI application is for disease prediction and diagnosis, treatment, outcome prediction, and prognosis evaluation. So not that you want to get into the point of using AI algorithms to deny care or to approve care, like some recent health insurance companies have gotten in hot water for recently in the news. But it can help clinicians understand, given this disease, given these contributing factors or these symptoms or these diagnoses or the treatments available, what are the possible outcomes? What are the predictive outcomes for taking this course of treatment versus that course of treatment, which helps clinicians give those options to patients. Because a lot of times, especially with clinicians being pressed for time, having many patients, a lot of times like patient education is something like, here are a couple pamphlets with your options. You got to pick one, let me know. The end, because we don't want to take away autonomy from patients, but patients are left they don't have the data or the knowledge or the information to make a good decision. So they're hoping their doctor or their nurse or somebody can help them with the decision. The doctor or the nurse is too busy because they've got too many patients. They don't have all the time in the world to sit down and explain all of the outcomes to patients. So something like this can really help bridge that gap in a big way, right? It allows medical professionals to embrace like proactive management of diseases at the onset, and it helps identify potential risk factors ahead of time. So the doctor could say to a patient, listen, there's like 5 or 6 different options for this disease, for this treatment. There are 5 or 6 different treatment options, but given the risk factors and kind of where you're at, these are probably the 2 or 3 most beneficial for you or most likely to have positive outcomes based off of the models or whatever. And then maybe it even gives the patient some information that they can then use to think about and make the decision for themselves, right? Doctors obviously benefit from having more time to be able to spend with the patients and help those patients or facilitate a better patient decision. And some of these learning tools, these large language models and things that can sift through data and make some of these predictive modeling can help those clinicians kind of cut through a lot of the superfluous information and give a patient exactly what they need when they need it as it relates to their specific diagnosis, which is, again, one of the underlying themes, at least in my mind, that I look at artificial intelligence and the ability for it to really impact care is not so much that it's going to take away clinical decision-making, that it's going to replace doctors or clinicians. The big thing is that AI, and I've said this before, is going to allow us to deliver a hyper-individualized plan of care to each patient in a way that is not possible currently with the time constraints that we have as clinicians. Regardless of your regardless of the payment model under which you're operating, right? Fee for service, value based, global sum, global fee. There's still a limit in the amount of time that we have as clinicians to sift through the available research, the available best practices, and make a decision for this patient given their specific circumstances. One of the great things about artificial intelligence is that it can cut through a lot of that. It can parse through a lot of that information much quicker than we could ever hope to, and give us some really viable options to do that, right? To do that for our patients, especially if you look at some of these models that are being built now that are not like just general chat GPT searching the web, but you could build an AI model and train it on data from a specific, maybe a specific clinical research institution or hospital data set or something like that. So it becomes actually very, very accurate instead of, just searching Google, for example. If you're controlling the data that the model is being trained on, you can be more certain of the validity of the recommendations of that model. So we've talked about that before on the podcast, that the weakness, or one of the potential weaknesses of artificial intelligence, is the data set upon which it's trained, right? You have to make sure that the data set is representative of the population, of some of those social factors, the demographics of the population that you're going to use it on, right? Like you can't take data for cardiology, let's say cardiology diagnostics or something like that, imaging diagnostics, the data was a bunch of 20 to 30-year-old Caucasian males or something like that, and now you're using it in maybe a minority, an inner city where there's a lot of minorities, and the average age range is like 50 to 60, right? Like those data sets aren't going to be representative of the population upon which they're being used with, and that could potentially lead to issues, right? So that's a side note, but the data is very important. But if you have a way to build these models in a way that you're able to use data from the community, from the geographic location even of the area that these patients are being seen, train an AI model on that data, and then use it for predictive outcome, that's huge. We had what was his name? Perfecto Sanchez was on the show a while back talking about equity multiple, and they kind of do this, right? Like they're taking all this data, the social determinants of health, and they're using it for geographic regions, and they're coming up with risk factors and flags and information they can give to a health system and say, listen, based off of your demographics and your own trends over the last 6 months, these are some areas that you need to be addressed, or you need to address, or you need to look out for patients with this diagnosis, as an example. You can do the same thing and apply some AI behind it, and I think they're doing that now on the back end to make those predictions more accurate. Again, to train the data or to train the model on data from that population and make it more individualized and specific, right? Clinical decision making is the third area that they say AI can impact care, and we've talked about this a lot. Like clinical decision making aids, that they're not replacing clinical decision making, but they're offering. Dr. Harvey mentioned, like, think about an ER doctor. It's their, hour 12 of their 12-hour shift, and somebody walks in with, what potentially looks like a very simple run-of-the-mill emergency in an ER, right? And a clinical decision-making aid, if you put that patient's information in, the clinician's writing up their note or whatever, about to make recommendations, it could flag and potentially catch something that would be missed, not because the doctor's incompetent, but because the doctor's been on shift for 12 hours and their mind, their cognition is affected just from fatigue, right? So AI can help physicians make better clinical decisions, or even augment human judgment in healthcare-specific functional areas, according to this study. So algorithms can benefit clinical decision-making by accelerating the process and the amount of care provided, positively impacting the cost of health services. So there's a financial impact as well. You don't want to bring it all back to finances, but honestly, like, if clinicians are able to, if hospital systems and clinicians are able to deliver care more in a more financially sustainable manner, it means they can spend more time with patients. It means they can spend more time building human relationships, or potentially catching things that would normally fall through the cracks, right? Some of those social determinants of health that aren't readily available in a patient's chart or something like that. And then the last two areas were patient data and diagnostics. So I think diagnostics is pretty straightforward. You enter some symptoms, and it could give you some information. I think one of the more interesting applications of this, like specifically in the musculoskeletal space or something like that, there are tools out there now where, even just a webcam or something like that, a patient can go through a series of movements, and the algorithm can kind of take that movement pattern, analyze it, and give you like granular details. Like, you're in a squat, for example, you had a 5-degree valgus variance in your left knee, or there's this asymmetry between your hips and your low back or your shoulders, or between left and right. And maybe 5 years ago, when these things were first coming out, I looked at a bunch. I consulted with a few companies that were doing this, and the reports were they were wildly, again, granular and specific and accurate, but they just did not display the information in a way that was like clinically relevant. Like, how do I take this and then, one, make it make sense to the patient, and then two, make decisions based off of that. And now they've gotten to the point where, they can even give you like potential muscles or muscle groups to address, joints to address, things for further exploration and further evaluation. So not that, again, it's not going to replace a clinician, but it can be a rough screening. And then when the patient comes into the clinic, the clinician is more can get to what is the heart of the matter without having to go through a whole preliminary kind of screening and diagnostic piece, right? So it can make it more accurate, make it more timely, make it more specific to that patient in a way that, again, saves time, saves money, improves accuracy. And this kind of speaks to the kind of this hybrid model of care that we've talked about a lot on the show, but the idea that a patient doesn't necessarily need to be in the clinic, and you can think about the patient journey as not just when they're coming into the physical location to have a hands-on evaluation by a clinician, but really have this digital patient journey, if you would, where maybe the care begins with like an AI screening that maybe provides some preliminary recommendations to a patient, and then they start like a digital care pathway that then might involve them coming into the clinic, might involve them not coming into the clinic. And that's really where some of the exciting things are happening in healthcare, for me anyways, where I think like the power that this type of technology has for us as clinicians is the ability to provide care in a way that is, one, not just falling into this like fee for service, billing things out, but it makes us more efficient, hopefully improves outcomes, decreases the cost of delivering care. And I think it will push us more towards a value-based method of reimbursing for healthcare, right? Paying for outcomes, if you would, instead of paying for procedures. Because one of the big disruptions that these types of tools have is that they don't fit really into our CPT codes. Like, how do you code an online screening for a patient that does a movement screen online? The AI model evaluates it, gives them some recommendations. And then they, maybe they don't need to come to see an orthopedic or a physical therapist or something like that. How does that get covered, right? So it's going to force payers and providers to think about getting reimbursed for this, or getting paid for the value they're providing in a different way, which I think is going to be awesome. The other area is like what it's going to do from a regulatory standpoint. Like as someone who sits on a national board and who sat on a state regulatory board, like telehealth was kind of the big monkey wrench that got thrown into this back in 2020-ish, because for the most part, regulatory agencies didn't have to worry about people from outside of their jurisdiction treating people within their jurisdiction, right? And that's kind of was one of the big things when telehealth happened, was like, okay, you need to be, and most states do this now, in order to provide, I'm an occupational therapist, in order to provide occupational therapy, for example, in the state of Georgia, whether you're located in Florida or California, you need to hold a license in the state where the patient is receiving services, which never made sense to me. I was like, you're a licensed clinician in Georgia. Maybe the patient is from Georgia, this happened to us at the clinic a few times, flew to, cross country for a funeral or for a vacation or whatever. They're immediately post-surgical. We want to be able to provide care for them. Like, I'm not going to go pull a license in Washington or California or something like that for 1 week for one patient. But that's where we're at. And I know that there's like licensure compacts and things like that, licensure portability legislation and regulation that's kind of matriculating through various legislative bodies and stuff like that. But I think it's really, it's a Band-Aid on a really gaping wound that is like, how do we regulate healthcare, provide public safety, which is what regulatory agencies are supposed to do. They're supposed to ensure the public is not harmed by healthcare providers, right? There's a way to do that without individual state licensures. Now, I'm not going to get on I'm going to get on my soapbox here. I personally believe like state licensure should go away, and what should happen is your license to practice in whatever field should be like a driver's license. Like, I don't need to get a driver's license in South Carolina because I'm in Georgia. My Georgia driver's license works in South Carolina, in West Virginia, in California. It works all over the place. It should be the same way with healthcare. Your clinical license should be able to work wherever you go, right? It should be seen as a driver's license. And then maybe, yeah, sure, if you're going to reside in Georgia, you pull a Georgia license for this and it just works everywhere. Or, you move to California and you update your residency, right? I think that's going to be the way of the future for regulation. I think it's going to take a while to get there. We're still trying to figure out the pieces. Maybe the federal government gets involved, maybe it doesn't. I don't know. But it is something that I think we need to think about as healthcare providers when we consider the initiatives that we're going to throw our weight behind, so to speak, from like a lobbying standpoint or a advocacy standpoint. Do we really want to advocate for stronger state licensure, or do we really want to look at how do we broaden our ability, our scope, our jurisdiction to not just be within this one state, but how do we make it more portable, more accessible, so that you can provide the right care to the right patient at the right time in the right format, right? So anyways, those are my thoughts just from this article. I'll link to the article in the show notes at rehabupracticesolutions.com. If you want to listen to more of the episodes or follow the show in any way, go to betteroutcomes.show. You can fill out the email form there, and we'll send you the notes, the show notes and the links and all that to guests and to their bios and all of that kind of stuff whenever we drop an episode. If you want to explore more about Rehab U Practice Solutions, maybe healthcare positioning or go-to-market strategy, go to rehabupracticesolutions.com. That's rehab, the letter U, practicesolutions.com. If you want to learn more about me and connect with me, RafiSalazar.com is the way to do it. All right. Till the next time, folks, be safe, be healthy. I will talk to you then.